I'm Dr. Greg Hollstrom here at the Florida Center for Back and Neck Pain. Foot pain is not often a common presenting complaint, at least in new patients. But our existing patients know that we treat a variety of different things involving the majority of the joints in the body, and foot pain is one of them. A common problem with foot pain, and one of the most common, is plantar fasciitis. Plantar fasciitis is an inflammation of the connective tissue in the bottom of the foot and is usually related to collapse of the arch of the foot in flat feet. The arch of the foot is composed of foot bones which are rotated amongst themselves and supported by a band of connective tissue. When that connective tissue support fails, the foot uncoils and that connective tissue is pulled at its attachment site. And at its attachment site, it will cause irritation to the bone, bleeding, pain, and eventually can result in heel spur. Heel spur, as I found in practice, is not usually the cause of the pain, but a reaction to chronic plantar fasciitis. Plantar fasciitis responds very well to conservative care involving cold therapy, nerve and muscle stimulation to reduce inflammation and congestion, ultrasound, manipulation of the foot and ankle to improve mobility, and oftentimes construction of custom-made orthotics to help support the foot and ankle. Another common problem with foot pain is called metatarsalgia, which is pain which arises at where the toes attach to the foot. This oftentimes is accompanied with pronation or the flat foot, but is a common presenting complaint of foot pain in women who wear heels. As you wear a heel, your weight is transferred to the front portion of the foot, which will produce metatarsalgia, which is an aggravation of the support band that holds the toe onto the foot bone. Strategies for treating metatarsalgia involve taking the pressure off the foot, sometimes involving a change in footwear, ultrasound, nerve and muscle stimulation, and manipulation of the foot. And eventually, as symptoms subside and healing progresses, active rehabilitation helps strengthen the foot and the ankle, and sometimes the calf and shin are often implied. Sometimes flexibility is needed and active stretches are oftentimes given. I'm Dr. Greg Hollstrom here at the Florida Center for Back and Neck Pain in Largo, Florida.